COVID-19 can be characterized as a pandemic.
It's official. The WHO has now confirmed that the COVID-19 coronavirus has been categorized as a pandemic. Today, its Director General made the announcement and is calling for countries to take urgent and aggressive action. But he did add, it's still not too late for governments to act and for people to limit the spread of the virus. Here in Canada, confirmed and presumptive cases have now eclipsed 100. Today, Quebec and Ontario both added to their numbers. Good evening. 4 new cases have now been confirmed in Ontario. One of the latest is a government worker from Sudbury who appears to have contracted the virus at a mining convention here in Toronto last week. The health minister is acknowledging the situation is likely to worsen, and the Ford government is promising millions to help fight the pandemic.
We have a $100 million contingency plan within our budget to deal with COVID-19.
That money will be spent on more staff, supplies, test kits, and protective equipment, if necessary. Officials stress the virus is contained at this point in Ontario. However, Health Minister Christine Elliott admits it will likely spread further.
Is the next stage considered a possibility or an inevitability?
That's a very good question. I would say that it is likely that we will move to the next stage, but we have a plan in place to deal with it.
The minister insists hospitals are ready and that plans are ever evolving. One could be to have certain hospitals dedicated to coronavirus patients.
So we will see what happens if we need to open one hospital for that purpose. But if more people require hospitalization, then we have a team in place to deal with that immediately.
The province is in the process of creating assessment centres to ease the burden on hospitals and is also looking at in-home testing. The health minister is urging people not to go straight to an ER if they're concerned they have COVID-19 because staff won't be properly protected. Instead, they're being told to contact the local public health department first or call telehealth to give advanced warning. But long wait times are being reported. This is the message we got today when we tried telehealth.
At this time, Telehealth Ontario is experiencing very high call volumes due to COVID-19. Know that wait times are long, and we are doing the best we can under these circumstances.
Concern was raised to a new level today after it was confirmed one of the latest cases, a government ministry worker, likely contracted the virus at last week's mining conference in Toronto. Some 23,000 people from over 100 countries were there, including Prime Minister Justin Trudeau and Premier Doug Ford.
I don't have any concerns.
But it raises the question of whether the province and the City of Toronto should be more proactive and ban large gatherings the way other countries are. It's difficult to get a yes or no answer. Asking you about to second guess last week. Yeah. I'm asking you if you were asked today and this conference was going to happen 2, 3, 4 days from now, what would your recommendation be? Go ahead or pause?
Yeah, I think what we have seen as of late and what we have been finding as we consult with those who are holding or have conferences planned is that increasingly we're saying, look, limit the number of people that are there.
Education Minister Stephen Lecce also held what his staff called an emergency conference call with other education ministers across the country. They discussed New Brunswick's decision to make all students who travel out of country during March break to stay away from school for 2 weeks. Do you think that Ontario should be adopting those measures?
Right at this stage, I would say no. Right at this stage.